Welcome to the Mama Say Fit YouTube channel. In this video, we're going to talk about what is the best pushing technique that you can use during your birth. Hey, my name is Gina. I'm a birth doula and perinatal fitness trainer.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife.
Between the two of us, we have over a decade of experience supporting in-person births. And so we have supported a lot of people while they are pushing their babies out of their bodies. And so we have learned tons of different techniques that we have found to be really helpful for all these people in these different situations. So I have an experience as a doula supporting births, which is going to be external. So I'm not putting my fingers inside of anybody, and I'm going to be observing things from the outside perspective.
Or I'm able to give more internal feedback when someone's pushing to be able to say which ones are more effective based off of actually seeing baby move down.
And because of our experience as perinatal fitness trainers, we then create programs based on what we're seeing during births to help folks prepare for their birth with prenatal fitness programming and pelvic floor relaxation.
So Gina, what is the best pushing technique?
Because there's definitely only one way that
Only
everyone
one way.
should
It's
push
black
their
and white.
babies,
What is good?
push their babies down.
What is bad?
So the best pushing technique that you can use during your birth is the one you choose. Video is over.
Done.
That's it.
Thank you for coming.
So obviously there's nuance when it comes to birth because all of us are going to be approaching our births in different ways. We're going to have different types of interventions during our labors. We're going to be in different types of facilities that are supporting our births. There's going to be different types of support for you during your birth with your medical team and with your additional support team that you've chosen. And so all of us are going to be kind of coming at it with a different circumstance. And so it would be silly to say that there's only one way that everyone should push their babies out. Roxanne, what are the common things that you see on social media as the quote unquote best way to push?
Breathe your baby down in an upright position.
And that your body will just do it. You don't need to push at all.
Just breathe and your baby will come out. Don't hold your breath.
And your baby will just fall out
in a beautiful field of meadows.
So this can happen for some folks. It can be a realistic way that you can expect to push your baby out. I find it tends to be most realistic for folks that are unmedicated and they have almost no interventions going on with their labor. So it's probably not going to be the most common way that you see somebody push their babies out.
Some epidurals will be so dense that you feel nothing and your uterus will push your baby out.
So let's discuss the two main ways that you can breathe while you are pushing your baby out. And it can also be a combination of the two. The first is going to be open glottis pushing, gentle pushing, which is what most folks are referring to when they say that the best pushing technique is to exhale and let your baby just kind of fall out of your body. The benefit of doing open glottis pushing is our jaw is attached to our pelvic floor. And so jaw tension can increase tension in our pelvic floor. And so if we have an open throat, which means our jaw is probably also relaxed, we probably also are going to have a more relaxed pelvic floor, which is then going to make it easier for our baby to move through and could potentially decrease the damage or the trauma against the pelvic floor during a vaginal birth. And so that could be a huge benefit of doing open glottis pushing. Open glottis pushing can also be just as effective as closed glottis pushing, which is where you hold your breath and you bear down, which is what you are probably most familiar with in a hospital setting, or you may be most familiar with from media and movies and stuff, is folks kind of holding their breath and just bearing down.
Purple-faced pushing.
And so open glottis pushing, in comparison to that, can be just as effective. However, it can be hard to kind of figure it out in the moment. And so what we would recommend is during your pregnancy, whenever you're having a bowel movement, to practice it and see how it feels for you in your body. And so you'll take your big inhale down to push the diaphragm down. This is going to increase pressure in your abdominal cavity, and you'll feel it increase the pressure down in your perineum. And then you'll just kind of continue to exhale with that pressure downwards to push your poop out. And so that can be a really helpful way to practice gentle breathing during pregnancy so that it becomes more intuitive during labor, because not all of us push babies out of our vaginas frequently. It's maybe once every 2 years for a short period. So it can be an unfamiliar thing to try to figure out during birth, and it's much easier to coach someone through closed glottis pushing. So Roxanne, what is closed glottis pushing in comparison to open glottis pushing, and what are some of the benefits of holding your breath while you bear down?
So closed glottis pushing, or It's sometimes called purple face pushing because if you hold your breath for 10 seconds, take a deep breath again, hold your breath, let it out, take a deep breath again, your face will kind of turn purple. And especially if you're holding just all of the air here in your face will just turn purple over time. And so they call it purple face pushing. It increases the stress within our bodies because one, you're in a stressful state of not breathing for 10 seconds. And then with that breath though that you're holding in, the goal is that you're pushing that like air downward, increasing the pressure within your abdomen to push your baby out. With purple face pushing or closed goddess pushing or just holding your breath when you're pushing, it is viewed as more forceful because of the effort that you hold in your face because you're also holding your breath. So it's viewed as more forceful. But again, it can be just open glottis can be just as effective as closed glottis pushing. It's just the perceived effort is different. It can be more stressful to our babies because, again, you're holding your breath for 10 seconds. So I normally only recommend people hold their breath for about 6, maybe 8 seconds, because that's usually where people will start to lose their oomph because 10 seconds is a really long time to hold your breath, whereas 6 to 8 seconds is a lot more manageable for most people. With closed glottis pushing, again, because you're holding your breath, this could lead to decreased amount of oxygen that's going to your baby, oxygen and nutrients that are going to your baby, as well as if you're in a certain position, this is also decreasing the oxygen and nutrients to your baby if you're laying on your, directly on your back. So it can lead to some distress for babies when we're pushing with closed glottis pushing. And then there is also an increased pressure on your pelvic floor because it is, again, a little bit tighter because we're not as loose in our jaw. So it can lead to some pelvic floor dysfunction. But it is the easiest to coach in the moment. It is really hard to coach someone how to exhale forcefully without just going, because that's not as an effective push as getting someone to hold their breath and bear down. So closed glottis pushing, again, it's easier to teach in the moment to get someone, everyone knows how to hold their breath. A lot of us naturally will hold our breath when we're pooping as well. So we're used to holding your breath and bearing down. That's why it's so beneficial if you do want to use open glottis pushing to practice during pregnancy, because you will be able to figure it out in the moment really easily, especially if you're getting an epidural. With closed glottis pushing, it is really easy to coach. And I feel like it also helps people figure out how the hell to push, because they're able to feel more pressure within their bodies to be like, oh, when I do this, I feel it here, even with an epidural, to be like, okay, that's where I want to push, that in that direction. Whereas with open glottis, it's a little bit harder because there's just not as much pressure that I'll feel.
There's also just more things happening with open glottis.
You have to
you're thinking about, okay, I'm exhaling strong, pushing down. And so there's just more steps happening at the same time, while closed glottis pushing, you're holding your breath, and then you're just focusing on the push, which can sometimes be easier in the moment to figure out.
Yeah.
So it may seem like, well, there's lots of benefits to open glottis pushing, and there's almost no benefits to closed. So why would anyone choose to hold their breath? Ultimately, it's about what feels best for you in the moment. And so if open glottis pushing is just not feeling intuitive for you, or it's just not working, closed glottis pushing can be a really good option. And you may find that you kind of combine the two as well. And so this is why we say the best pushing strategy is the one that you choose, not the one that you're forced to do. And so if you want to try open glottis pushing during your birth, we definitely recommend practicing it during pregnancy on the toilet with your bowel movements. But know that closed glottis pushing is still an option available to you should you want to during your birth. And so some things that you can do to kind of help with that pelvic floor relaxation with closed glottis pushing is to not clench your jaw and squeeze in your face as you are pushing. We're still thinking relaxed face as we kind of hold our breath and bear down. And so if you really think about the jaw tension, that's going to really correspond to the relaxation of the pelvic floor, and then also decreasing the duration of those pushes from 10 to about 6 to 8 seconds, which is just more manageable for most folks. I would say the majority of my doula clients that are pushing, once they get to 6 to 8, they kind of stop pushing and they're just holding their breath at that point. And usually I'll tell them to reset. I'm like, hey, just go ahead and take a big inhale, get ready for the next push. And so that can also be another strategy to help kind of mitigate some of the quote unquote risks of closed glottis pushing or pushing. And again, it's about whatever feels best for you in the moment without feeling judged about doing either one.
And with closed glottis pushing, a lot of these studies were done that compared the two. People who are doing the closed glottis pushing were just laying on their backs, which, as we know, is not the ideal position for our babies. One, it like decreases the room for the sacrum, but you're also just laying flat on these two blood vessels that are running down your spine. So this is also decreasing the blood that's going to babies. So it's hard to say which one was causing the decreased oxygenation to the babies. Was it just purple pushing, or was it also the fact that they were laying on their backs? So another way we can mitigate that is that if you're laying on your back, maybe tilt to the side to decrease that pressure on those blood vessels, or be in an upright position. But again, if you really find it more powerful to lay on your back doing closed glottis pushing, and you feel comfortable and you choose that, not somebody else, then that's the best pushing position for you. And that's where you're going to be most powerful.
So if you want to learn more about different pushing strategies so that you understand what your options are during your birth, join our online childbirth education course. We have an entire section just on pushing where we go over all sorts of different pushing positions, both for an epidural and for unmedicated birth. We go over different breathing strategies, different pushing strategies, such as how should you position your spine, where should you direct your force, and then also how can you reduce the risk of tearing during your birth. And so if you want to dive deeper into pushing and then all of the other things involved with birth, join our online childbirth education course, and you can use code YouTube10 to get 10% off our online course. And you can also bundle it with our prenatal fitness programs, where we include a lot of exercises to help you prepare to not only open the bottom of your pelvis, but also to strengthen the musculature that you need to help have a powerful push. And you can bundle them for 15% off, add on that 10% off code, and it's like a 25% off deal.
Basically free.
So like girl math, like it's pretty much free. So you can check out all of our courses on our website at mamasayfit.com/childbirth if you specifically want to check out our childbirth education course and all the bundles offered with it. And so in summary, Roxanne, what is the best pushing technique?
The one that you choose.
And so if you don't take anything else from this video, just know that the decisions that you make for your birth and for your pushing is the best. Like, it's okay if it's different than what somebody else chooses. It's okay if it's different than what like mainstream, like social media is telling you is the best strategy. We just want to let you know that whatever you decide is best for you during your birth and during your pushing, it is the best decision for you, and we fully support you.
If you enjoy this video, please like and subscribe to our channel so you can be notified when we release new videos. We try to release 1 to 2 new videos a week, one being a workout, one being educational. If there's a specific topic that you're hoping to learn more about from us, comment that topic below and we'll be sure to make a video about it.